Welcome you all to the Creators Learning Table series for the month of September. Before we get started, I'd like to give you an introduction on the Learning Table series. So, this is for people who are new to the Learning Table series. So, this is a month on month webinar where we take a particular industry and we try to identify a use case and we try to build a solution using the industry that we have identified. For this month, we have made use of the healthcare industry and we have tried to identify a use case and we have built a solution using the use case. Now, before we get started, I'd like to share you some information regarding our upcoming Zoho Creator Roadshow. We are we are presenting the roadshows in three different locations, which is in London, Berlin, and in Madrid. So if you are interested or if your colleagues who are interested, you can share this QR code or you can also share the link that my co-trainer will be sharing with you in the chat section. Let me just explain you what we'll be doing in the roadshow. So this is an in-person session where we will have trainers from the Zoho Creator training team to present to you about the Creator platform, which would cover from the basics to the intermediate part. And you can have your questions answered. You will have live Q&As, and you will be able to have a hands-on practice on the Creator platform. This is happening in London between October 8th to 9th, and in Berlin between October 14th to 15th, and in Madrid, so it is happening between October 22nd to 23rd. So you can make use of this QR code and register yourself, or even you can share it with your colleagues who might be interested in attending this in-person roadshow as well. I'll just keep this screen for open for a while. You can scan this QR and register yourself as well. So now let's get into the session. So before we get started, let me just give you an introduction on the industry that we have taken, which is the healthcare industry. So as I mentioned in the learning table series, we will identify and use industry and we'll make use of an use case from that particular industry and we'll try to build a solution upon it. So this is what we have done here in this particular session. We have identified in hospital management and then we have tried to build a solution upon it. So before we get started, let me give an introduction on myself. So I'm Pungode from the Creator Training Team and I'll be taking you throughout this 1-hour webinar. So apart from this, we'll also like to share you a few of the housekeeping rules for this webinar. All the attendees will be on mute throughout the session. If you have any questions in between the session related to the use case or the application that is being demonstrated, you can always post them in the question tab. My co-trainers will be answering it for you. And a recording of this session will be sent to all the registrants and the attendees post this session. And we would also request you to participate in the polls and surveys that we'll be handling at the end of the webinar. So now let's take a quick look at the agenda for this 1-hour webinar. So starting with the introduction onto the Creator platform, we'll enter into the use case that we have taken, which is the hospital management. And then we'll look into the application process flow. So how the application process flow for the hospital management is being established. And we'll also look into the different features that we have incorporated in this particular solution. And we'll also look into the live demonstration on the application process and how it can be utilized by the end stakeholders. And not only the application, we'll also cover a few of the extended use cases. So apart from the application that we're showcasing you, how you can extend this particular solution. And at the end of the session, we'll have a quick summary of what we saw in this 1-hour webinar. So this is what we have in for the agenda. Now we'll just get into the session, starting with the introduction into the Creator platform. So this is for people who are new to the Creator platform. So Creator platform is a low-code custom application development platform, which would allow you to develop multiple applications for your business requirement. And not only just an application, but also you will be able to develop business intelligence. You will be able to get the analytics, and even you can perform the integration concepts where you will be able to connect with other third-party application, and also you will be able to bring in the process automation inside your application. So using a single Creator platform, you will be able to bring in a bring in multiple solution inside your application. And using the platform, you will be able to build an end-to-end solution for your business requirement. And whenever someone talks about a low-code application platform, people might be wondering like if it is restricted to any specific industry or any specific use case. But here, Creator, you will be able to fit in into any kind of industry or any kind of business use cases or any other process that you would like to automate through the application. So now let's get into the understanding about how you can categorize your application that you're building inside your Creator platform. So here, to explain it in detail, we have categorized into four majors. So starting with the internal tool. So if you're building your application that would majorly focus on all the communication that would happen between your internal organization or the process that is involved inside your organization, all the internal stakeholders who are communicating. So that would be categorized under the internal tool. And if you're building a solution where it majorly incorporates on all the interaction and communication or the process that would be involved with an external stakeholder, that comes the part where you will be making use of a portal. So that kind of applications will be categorized under the portal based application. And next comes the interesting part, where you will have a lot of process that will be handled in a single application. You will be interacting with all the internal stakeholders. You will have a lot of process that will be involved. So that kind of application can be categorized under the core systems. And apart from this, if you are extending your application with any other Zoho or any other third-party services, that can be categorized under extended Zoho or third-party application. So these are the four major categories through which you can categorize the application that you're creating using the Creator platform. So now let's quickly take a look at the industry that we have taken for this particular month. So which is the healthcare industry. So whenever we talk about in healthcare, it is a vital system that would promote the well-being of an individual through medical services, not only just the medical services, but also the prevention methods that has been done, and also the treatment of the illness that patient might have. Right, so it does not just simply comprise of the medical services, but also it comprises of multiple stakeholders, multiple disciplinary people who are working together to ensure the physical and mental health of the individual or the patients who are coming into this particular system. Right, and apart from this, when we consider the process of handling these different methods and the process in the digitalized manner, if you like to automate them, you can make use of the digital solution like managing the medical records, scheduling the appointments for the patients, if and to track the health information like how they were in the previous history and how you can promote or how you can enhance the health of the patient in the upcoming days. This would actually empower the users with convenient access to the healthcare services, and you can also personalize the health information. So this would be a major improvement in the healthcare industry whenever a digitalization process happening. And you can also bring in an effective communication, and you can reduce the time that is being taken for these multiple processes to happen inside a healthcare industry. Now what we'll do is that we will just understand the major application development process, and then we'll get into the process flow of the application. So usually whenever we start building a particular solution, you will have to understand the steps that would be required to build a solution. So here the use case that we have taken is the hospital management. So before we get directly into the application development, we will have to follow some kind of application process flow through which you can understand the application life cycle and how you can bring in your application development process in a smooth manner. So starting with the requirement analysis. So you will have to analyze your requirement. For example, here inside our use case that we have taken, we have understood the major process that is available, and then we have analyzed in which process you would like to automate your application. And post the analysis, you will be able to structure out the application, like the number of modules that would be required and number of stakeholders who are part of these different process and the modules as well. And once you have structured your application, you will be able to get into the important part, which is the development of your application. So post the development, you will be able to share the application, deploy the application to the end user or any other stakeholder who are part of your solution. And once you have deployed or shared the application, you will have to manage them. The roles and the permission set that has been shared with them has to be managed and tracked. So that is where we will manage the application as a whole. So you can see this would be the step-by-step process that one should follow whenever they are developing a solution or an application for the business requirement. So for this particular use case, we have made use of the same steps, starting with analyzing the major process, and we structured the application based on the requirement, and then we got into the application development, post which we were able to share it to the end user, and then we were able to manage the solution as well. So now we got an idea about the application development lifecycle. So now let's get into the application process, the major process that is usually involved in a hospital management. So starting with the patient management. So whenever we talk about in hospital management, we will have a lot of interaction with the patient, right? So you will have to manage the patient details, or the history of the patient, and what type of consultation or what type of requirement they are coming inside, and for the services that needs to be provided from the hospital setting as well. And apart from the patient management, you will also need to manage the appointments that is being done by the patient. So the doctor's availability has to be checked, the number of appointments that is being raised by the patient, and you will have to schedule it for the doctors, and that would be a tedious process. So that is another major process inside a hospital. And next comes the part where we have multiple stakeholders who are working in a hospital. So not only just a doctor, but we will also have other disciplinary working in the hospital. Like you will have a non-working staffs, you will have the nurse, the admin, the HR, and few other employees who are part of this healthcare setting. So you will have to manage the details of the staffs, and along with the schedule for the doctors as well. So that has to be monitored. And now when we talk about a consultation that is happening in a hospital, a payment has to be done by the patient, right? So you will have to track the payment for the services that is being done. So are they coming in for a normal outpatient consultation, or is it for a simple admission process, or just they would like to get themselves tested in a lab? So that would also be captured, and you will have to get the payment for it, right? So apart from the in the outpatients who are coming inside the hospital, you will also have some online consultation that would simultaneously happen on the other side, right? So whenever a patient comes inside the hospital, they'll be able to have an appointment, and they'll be able to view the doctor directly. However, in different scenarios, when we think about, there are patients who will not be able to directly access the doctor in person, wherein they might be in another part of the country, or they might be in another part of the city, and that would be a difficult process for them. And even taking a scenario wherein the elderly people who have the less probability of traveling so far to visit a doctor. So right, in these scenarios, an online consultation would be helpful inside an hospital management, right? So that would be another part. And apart from these, you will also have the multiple testings and lab reports has to be managed for the patients. And in this scenario, there are possibilities like a mismatch of the results, or there are possibilities like the results not getting generated, and there might be delay in the testing or the processing or the payment as well. So these can be monitored, and these has to be taken into consideration whenever you're trying to automate your application. And next comes the part which would be mostly of the supply management. So wherein we have multiple medicines, the medical equipments that is being used inside a healthcare service, right? So you will have to track the inward and the outward of the medicines and the supply that is happening inside the hospitals as well. So these would be the major process. And now what we have done here is that for the use case, we have identified around few of the process, and we have tried to automate using the solution. So starting with the first process, which would be the outpatient management. So here the hospital management will be considered as a core system wherein we'll be dealing with a lot of process that will be involved inside the hospital. So starting with the outpatient management, so you will have a lot of patients coming inside the hospital to have a general checkup or specific to some kind of symptoms. They would like to meet the doctor and have a quick check on their current symptoms, and they would like to get a remedy for it. And apart from this, we also have the inpatient management. So, wherein you will have the inpatient admission happening, you will have to collect the history of the inpatients, and you will have to allot them rooms, and the treatment course of them has to be managed inside the hospital, right? So, starting from the admission to assigning the doctors who will be responsible for the patient, and the payment details, the billing, and also the discharge summary for these different patients who are in the admission process. And next we have the inventory. So whenever the inpatient and outpatient are a part of this hospital, they will have a lot of requirement for the medications. The medical equipments has to be provided to them. Based on the requirement, you will have to manage the inventory. So we will be able to cover the inventory management in the hospital management setting. And at the end, for the service providers, the staffs who are available inside the hospital, so that schedulings, the availability, and how you can manage the available staff has to be tracked. So we have a separate configurations to manage the staffs who are available there. So this would be the major process that we'll be covering in the hospital management. So now let's get into the first module, which is the outpatient management. So in the outpatient management, it will always start with the appointment booking. So the patient might come in person for the appointment, or he or she can make an online appointment as well. So whenever we are talking about an appointment booking, it will be taking into consideration of if they are a new patient, if they are an online consultation patient, or they are about to come inside the hospital for the checkup. So whenever an online consultation is about to happen, we'll have to create a separate meeting for them to have a communication between the patient and the doctor. And when it is an in-person consultation, you will have to check the doctor's availability, and based on that, you will be able to allot a schedule for the in-person patient who is coming in for the outpatient checkup. And now, once they have finalized like what type of consultation they would like to prefer for the checkup, they'll have to mention if they are a new patient or an old patient. So what if they are a new patient? You will have to register them into your system or inside the organization. So in this way, you will be able to monitor and manage their overall information that is available inside the organization. And next, when we talk about an outpatient, you will be able to capture all the history of consultation. So based on the registration number, you will be able to capture the past admission history, their past outpatient history, along with the medications that were provided to him. So this would be the initial part of the outpatient management. So once these are finalized, you will have to start with the allocation on the bookings and the date and time. So here they will be able to choose when they would like to book an appointment and at what time and date. So based on this date and time, what we'll be able to do is that we'll be able to send a reminder to the doctor as well as to the patient, mentioning that you have an appointment that is about to be happening. Like for example, usually what happens whenever we visit in a hospital, we book an appointment, there are possibilities that we might miss out the appointments that is being booked. So in this scenario, by sending a reminder, this would be notifying the doctor and the patient so that they can follow up on the appointment that is being booked by them. So once the reminder has been set, they'll be able to get into the consultation and get the consultation from the doctor. So post the consultation, the doctor might mention that they would require to go for a simple lab testing or any other requirement related to the symptoms that they have. So once they get the lab results, they can come back to the doctor and get their health checkup completed, and the symptoms related information can be captured by the doctor as well through the test and the lab reports. So now post the results, post the consultation, what we can do is that we'll have to capture the consultation payment. So this would happen in the simultaneous manner. So this is what we have automated throughout the process, starting from the patient, the outpatient getting admission for the consultation, and till the part of getting the payment and getting their lab results for their personal suggestions or personal prescription that has been provided by the doctor as well. And next module is the inpatient admission. So here where it will start with the admission of the patient. So here in the initial part, you will start with the collecting of the history of the patient, like the symptoms, why they're getting admitted into the hospital, and did they have any kind of previous incidents regarding the symptoms. So those kind of information will be captured. And next, the consultation doctor will be monitoring the observation. He will monitor like what is the condition of this patient and what kind of treatment course we will have to follow. So during the consultation, the doctor will mention the treatment plan. If it is they'll have to go for a simple surgery or they can just go for a normal treatment medicine course itself, that would be finalized. Post the finalization, they will have a lot of follow-ups that would be done during the admission period. So usually what happens in a hospital setting, you will have a lot of doctors who will go for rounds, and they will have the vitals being checked in a regular time period, and you will also have the nurses who will come and check in for the medications administration and few other follow up regarding their vitals as well. So that would be the part of the follow up during the treatment process. So post the follow up, they will be able to prepare a discharge summary. So once they have recovered from the issue or the complaint, they will discharge the patient, and then you will be able to generate the bill for the patient based on the services that is being provided, and also the treatment course which has been allotted to them. And once the payment is completed, the discharge summary will be shared to the patient, and post the discharge, they will be able to have a follow up with the doctor as an outpatient. So it is not required for them to have an admission again and again, wherein they can convert themselves into an outpatient and they'll be able to have a regular checkup for the doctors. So this is what we have in for the inpatient management, starting with the admission of a patient to the follow-up of the patient, discharge summary being provided, and follow-up during the treatment as well. And apart from the outpatient management and the inpatient management, next comes the important part, which is the inventory management, where we have two major categories that needs to be captured in an inventory, which is the process related to the inventory, inpatient inventory, and the outpatient inventory. When we discuss about an inpatient inventory, it will start from the room booking itself, the number of rooms that is available, and also the medicines that has been provided to the inpatient, and along with the medical equipments that is used during their treatment course. So that is also captured under the inventory, and you will be able to have a track of it, and you will be able to restock the required equipments and restock the required medicines as well. And when we talk about an outpatient inventory, it will just wholly consist of the medicines. So since whenever someone comes as an outpatient, it will be a simple minor symptom or a simple disease course there, right? So they can just get rectified, or they can just get the treatment through the medicines itself. So this would be the overall inventory related part. So now these are the major modules that we'll be covering. Now, before we get into the application, I'd like to take you to the part where we have incorporated few of the features from Creator. So what are the features? Starting with the portal. So what we have done here is that we have given an external portal to the patients, so that they can sign up and log into their portal, and they will be able to view their assigned modules, like how they can view the lab results, and the appointment booking process can be directly done through the portal itself, and they'll be able to have the other modules access to the portals. And next we have the blueprints. So we saw about a lot of process that is involved here, starting from the treatment course and the lab results being generated, and how the overall process being defined inside the module, right? So we have incorporated multiple blueprints to have a streamlined process inside these different management. And then we have made use of the report workflow to create few custom actions in the report, since we have a lot of through and through communication between multiple modules. And at the end, we have also attached a record template to customize the individual record that you have inside your application. So these are the few features that we have incorporated. Now let me quickly get into the live demonstration on how the application has been developed and how the user will be able to access it. So yeah, this is the application that we have built. So this is my dashboard that you can see. And on the left, we have multiple modules that we have created, starting with the appointment booking for the outpatient and the online consultation. And we also have few staff duty details based on the available staff and the consultation details. So if it is in-person consultation or an online consultation, those details will be captured. And also if it is an outpatient consultation, what kind of treatment course is happening, and the lab test and reports for the users or the patients who are coming in, and for the lab technicians to access them. And we also have the inpatient admission. This is wholly for the inpatient to get admitted inside the hospital, and then we can get the history of those inpatient admissions. And then you can have a separate report which is available here to have a small follow-up during the treatment which we saw, which will be done by the nurses or the visiting doctors. And then you have the treatment course for the inpatient and the surgery plans for the inpatient as well. And not only that, we also mentioned that we'll be monitoring the inventory that is available inside the hospital management. So starting with the inventory, we have the medicinal inventory and also the equipment details as well. And then we have a final billing details to capture the final billing of all the inpatient admission. And we have other few reports like to capture all the other specialties and the staffs and other registration details of the patients as well. So now what we'll do is that we'll get into the process one by one, starting with the outpatient appointment. So I'll just get into the booking details. And here, using this module, the admin or the patient who is about to join as an outpatient will be able to make use of this form, and they'll be able to book their appointment as an online consultation or an outpatient consultation. So now, first, whenever they get into the appointment booking, they will choose if they are a new patient or they are an old existing patient inside the hospital. So whenever a new patient comes in, they'll be able to click onto the new, and they can register themselves for the hospital. So I can just mention my name here. I'm registering as a new patient. You can give the information, and then we can give an address. Post which the healthcare number will be automatically generated for the patient. So through the healthcare number, they will be able to access between the module, and they'll be able to get the other information, and they'll be able to have a quick communication within the application. So now, once they have registered themselves, they'll be marked as an old patient. And then you can see the type of appointment. So are they coming in as an online consultation, or they would like to be consulted as an outpatient? So in this scenario, we'll first choose the in-person, which would be an outpatient consultation. And then we'll have to give the healthcare number. So I'll just add the healthcare number. So I'm just manually adding over here right now. However, this healthcare number will be sent to the patient upon the successful registering themselves inside the application. So once they have registered themselves, if they are booking an appointment, they'll have to give the date of birth to capture the current age, and we'll choose it. And then we have the specialty. So which doctor they would like to visit. So we'll choose general medicine, and then we'll choose the doctor. So based on the specialty, we have the doctor name being populated, and then we'll choose the time. So we'll choose a future date, give it as 5 p.m. And then upon the submission, the appointment will be generated as an outpatient, and an in-person consultation will be generated. So let us submit it, and the submission is successful by the patient. So now what will happen is that a scheduler will be sent to this particular patient and the doctor regarding a reminder for the consultation. So prior to an hour or prior to a day, you will be able to send out the schedulers. So now once the appointment is being booked, you will be able to look into the details of the patient over here. So you can see we have the history of the appointment. So we have the details of the appointment. So I'd like to also add some another thing over here. So if it is an old patient, as we were discussing in the presentation, you will also be able to get their past history. So let me choose. So this is a healthcare number of another patient. So upon their healthcare number adding, you can see we have the history of appointment being added here. So if they have any previous admission related appointment, so I'll just click on to another healthcare number. So you can see we have the past admission related information that is being provided here. So this would give you the details about the patient, if they already have an history with the hospital or not, and you can also get into the details on their previous diagnosis and their previous issues that they were faced. So this is about the appointment booking, and now let's get into the module. So this would be the area where you will have all the appointments, and the admin will register the patient for the consultation. So post which what will happen is that the on the day of the consultation, if they are an outpatient, the doctor will be able to look into your details. So before the doctor looks into your requirement or looks into your particular details, they will have to collect the basic information. So usually what happens whenever a patient comes inside the hospital, they will have to collect the basic information like what is their current condition. So this would be usually done by the nurse or any other visiting doctors who is approaching the patient in the initial part. So here what we'll do is that making use of this particular button, which is a report action, we are being redirected to the in-person consultation to capture the initial history of the patient. So where the height and weight of the patient will be captured, we just give it as weight, and the BMI will be calculated, and then we'll have to add the temperature and why they are visiting the doctor over here. So let's just mention a simple symptom, muscle pain, and then they're visiting the general medicine because they have a muscle pain, and then we'll just give submit. So upon adding this information, the outpatient information will be added here, and you will also have the details which is being added onto this particular area. So where you can see the complaint which was added by us is muscle pain, and the healthcare number is added, and the height and weight and the BMI of this individual is being added into it. So now once the initial information is being gathered, what will happen is that admin will request for the payment for the consultation that is happening. So that is about to happen. So once the payment is being completed, so once the admin just mentioned the payment is done, the doctor will be able to look into the patient. So he will check the information like when they have come in, the complaint and the current BMI, and any other information, any other requirement is added. So they will just look into it. So here what we have done is that to automate the process of the diagnosis, we have made use of the blueprint here. So starting with the history collection, which is already done by the nurse or the visiting doctor, post which they will have to diagnose it. So upon clicking on diagnose, the doctor will be able to give the final diagnosis, and also he will be able to prescribe the medicines for this particular user. So let's choose a simple medicine, a painkiller. So just type in painkiller here, and he'll just choose the dosage and when the medicine has to be taken. So is it afternoon or morning or dinner? So he'll just mention the time, and we can mention after food, and he will mention the diagnosis, just simple muscle strain. So this would be a simple diagnosis. So if there's any requirement for the user to come as a follow-up, so they will have to follow up, or if the doctor is about to give him some lab test that needs to be done, so that would be added inside this date, and he will just mention when he has to come as a follow-up, and the schedule will be booked for this particular patient using this button. So we'll just create an appointment here and just we'll update it. So upon adding this, the consultation details, the follow-up appointment will be added. So you can see for this healthcare number, we have an appointment that is being booked, and we have the entry being added. So now if the doctor would like to give or prescribe for a lab testing or not. So he will be able to click onto this button, which is available here, which is also a report action through which he'll be able to access the lab reports for the patient. So he will be able to raise a request to the lab technician who is available inside the hospital, and he will mention when the particular testing has to be initiated and the specimen information. So what kind of specimen that they're about to collect. So we'll just mention tissue and the lab testing. So we'll just give some test here. So based on the test, we have automated the total count. And now what will happen is that the test is being assigned to this particular healthcare number, and the doctor will submit it. So upon submission, the lab technician will be notified regarding the test which is being prescribed to the patient. So usually what happens whenever we go to the hospital, the doctor will just mention a prescription in a paper, and we will have to go to the lab technician, and he will have to prepare the particular labs for the testings, and then it will take quite some time, right? So here, upon this simple form submission, the lab technician will be notified regarding the number of tests that needs to be done, and he will also be able to capture the payment. So upon the payment, he will be able to initiate the process that would be involved for collecting the samples, and he will be able to process the further details for the labs. So here, so once the payment is completed, it's getting loaded. Let me just refresh it. So yeah, once the payment is completed, the lab technician will get the specimen information from the user. So here as well, we have made use of a simple blueprint to capture this process. So we have a specimen collection process, and once the specimen is collected and they are processing that specimen, he will notify that using this particular blueprint transition button. And once he has processed, once the sample has been processed, he is sure about the results that is about to be done. He will just click on to result interpretation, and he'll choose when he is providing this result and the type of test that was done based on the tissue, and the result is negative, no symptoms or signs of blood clot. So he'll just mention the results, and upon successful submission, the result will be added. So now what the patient will do is that he'll be able to check this lab results in his module, in his portal, and then he can just get to know about the results over here. So here for the results, what we have done is that we have made use of a simple record template to give a more visually appealing UI for the record that is available. So you can see we have the Zilker Research Laboratory, and then we have the healthcare number, we have the type of test and the test which is requested on, and the result is negative here, and the result details that we have no symptoms of the sign of blood clot over there. So this is a simple record template that we have used to customize the view of the lab reports. So upon this view, the doctor will be able to view this particular module, and he'll be also having an understanding about the results, and also the patient will be notified regarding the information from the lab. So this is about the outpatient who is coming inside the hospital and making an appointment, and they were also able to get a consultation from the doctor, and they were also able to get in the lab testing, make the payment, and now they have received the results as well. So on the other hand, when we look into the online consultation, so let me get into the appointment booking. If a patient is booking an online consultation, let's just give an healthcare number. So we are registering this user for an online consultation. We'll choose the future date, and just sorry, this is a date of birth. I'll choose the date of birth. So we have the date of birth, and next we have the specialty, so whom they are visiting. So we'll just give general medicine, and we'll have the doctor, and then when they are visiting the doctor. So we'll have to choose an future date for this, since we'll have to book an appointment for the online consultation. So let's choose submit, and since it is an online consultation, what we'll do is that we have already integrated the Creator platform with the Zoho meetings using the Zoho Flow. So using the Zoho Flow, we have integrated it, and then whenever the appointment is being booked, under the consultation details, the doctor will be able to receive a meeting link. So currently you can see we have a few of the meetings that is appointed for this general medicine doctor, and when on the day of the meeting, he'll be able to click into the join meeting report action button, which is available here, and he will be directed to the Zoho meetings, and he'll be able to make a consultation. So you can see have the request permission. Just a minute. So upon clicking on to continue, he'll be able to join into the live meeting, and that patient will also receive the same regarding the meeting information. So you can see we have the meeting details being populated. Based on the date, this particular button will be available. And post the consultation on the online, they can the doctor will prescribe the medicines, and further process will be going ahead with the same process, like starting with the lab reports and the payment category. So those information will also be done simultaneously. So this is the outpatient consultation, starting with the appointment to having your payment being done and capturing the lab results and so on. Now moving on to the next part, which is the inpatient admission. So this is where you will be admitting the new inpatients who are coming into admission. So here as well, we have new patient or an old patient. So we'll choose an old patient and we'll give the healthcare number. So using the healthcare number, all the information is being added. And now here they will choose the complaint. So why they are visiting this particular hospital for. So we'll just mention chest pain, and then we'll choose the ward. So here the admin the receptionist who is getting the inpatient details will capture the information, and as soon as they mention the complaint, she'll just mention the ward, which would be cardiology, and you can see the type of room. So based on the available rooms, we will have the number of type of room that is available inside the hospital. So we'll choose a triple sharing, that is the only room that is available, and the pricing for this room is being added. So now once the appointment is being done, see the all information of the patient will be added over here. So now the room status is currently in booked. So right. So once the patient has been added, the next step is to collect the history of the patient. So what will happen is the initial visiting doctor or initial patient who is initial nurse who is visiting this particular patient will get into this module. They will have all the details related to this particular patient who has been arrived over there. So you have the healthcare number and the complaint, and also the admission number for this particular patient. And then you can see we have the inpatient diagnosis. So this would be the part of collecting the basic information, the symptoms of this inpatient. So we'll choose the specialty, and we have the visiting doctors who are available. And then we'll have to choose the patient status. So currently they'll be in the observation since they are in the initial part, and then we'll have to capture the symptoms. We'll just mention chest pain, and the course of symptom is 2 weeks, and any other comments if you would like to mention. So the visiting doctor or the nurse will mention the comments. So, and then here you can see we have the final diagnosis. So this can be done by the in-house doctor or even the visiting doctor. So if the visiting doctor is not sure about the diagnosis, he can just keep it for observation, and he'll just give it submit without adding the final diagnosis. So here what is happening at the back end is that, so based on this process, we have initiated a simple blueprint wherein the inside the all inpatient details, the doctor will be able to enter into this particular view, and he will be able to notify if the diagnosis is in progress or not. So this is what is another blueprint. So this is the blueprint area. So we have the blueprint for the lab results and the in-person consultation and the inpatient details as well. So this is a simple treatment process that we'll be observing. Starting from the in observation, we have diagnosed and treatment plan and the recovery and few other blueprint process which has been happening. And similarly, we have a few more blueprints which has been running at the back end. Now, for this particular process, currently the patient is in observation, and once the diagnosis is in progress, they will mention the it is in progress, and the visiting doctor or the in-house doctor who is in charge for this patient, he will just map it as diagnosis. So once he is ready with the diagnosis, or once he has finalized this would be the diagnosis, he will mention the diagnosis. So in the due course, they will assign for multiple lab testing, and multiple uh, medicines will go on the side by side. So we'll just mention he had a simple chest pain, can be mentioned here. And once he updates this information, the final diagnosis will be added here. And now, apart from this, the treatment, the final diagnosis is done. So next, what we'll have to do for the inpatient is that we'll have to start the treatment for them. So here we have the treatment course and the surgery. So based on the symptom, you will be able to choose if the doctor will be able to identify if a simple treatment course will be fine, or they will have to go for a surgery for this patient. So first, let me get into the treatment course. If they are providing a treatment course, we will have to fill in the information wherein the number of medicines that needs to be provided to this patient has to be monitored, and all the visiting doctor information and the nurses who will be visiting details will be added on in this particular module as well. So we'll give the healthcare number, then the final diagnosis, and then the treatment details. So what kind of medicine has to be provided. So we have the medicine that is available. So we'll just give 10 ml, and then is it an oral or an IV, and the required number has to be provided. And then you can see we can allot the in charge. So we have the available staffs, and then the in-house doctor who will be taking care, and then we can allot the other course. So for the next day, what kind of course of medicine has to be provided, and we can just give it the dosage the doctor will be able to provide, or if it is an IV or a normal oral tablet, so we can mention them, and the in charge nurse and the in-house doctors. So based on their availability on this specific date, the name of these nurse and the doctors will be added, since we have managed the staff management at the back end. So once they give submit, the treatment course for this patient of the healthcare numbers at HC005 will be monitored. And now the visiting nurse or the visiting doctor, what they'll do is that they'll get into the inpatient treatment module. They'll be able to look into the entry that has been done by the doctor. So the treatment course for this particular patient, which is for the admission number 80004, has to be done for an oral tablet. And what they'll do is that once they provide the tablet, they will map it to the administered. So what we have done here is that we have made use of a Kanban report to categorize the treatment process based on the medicines that needs to be administered, which is yet to be administered, and in progress. So if they are providing an IV, it will be mapped into in progress. So once the IV is completed, they can map it to the administered by just simply dragging and dropping them. So this would be the part of having a follow-up of the medicines which needs to be administered to the patient. And now, once the treatment course is done, what the doctor will do is that he will get into the patient details. He will just mention if the recovery is completed, and he will just mention that the patient is ready for discharge. So as soon as the doctor mentioned the patient is ready for discharge, the admin will be notified that this particular patient is ready for discharge. And what the admin will do is that he will just create a billing for his stay. So once he clicks on to the billing for treatment, he'll be able to create a billing for this particular user, and the date of admission and the date of discharge, and how many days of stay they were here in the hospital, and the service charges. So apart from the rooms and the medicines, what further services were being provided to this particular patient. So he can mention the required service charges, and then the total amount has to be paid. So once this is submitted, the user will be notified regarding this particular bill, and they will receive an invoice. They'll be able to notified regarding this bill, and what they can do is that they can come in the cash register, and they can get into the admin and they can make the payment. So once they have made the payment, we can prepare a discharge summary. So this would be the process that can be monitored. So we were also discussing about another course. So what if they are going for a surgery? So in this scenario, let us try adding another patient. So we'll choose old, and then we can choose a ward. And so based on the availability, we will have the wards which is being provided. So we have a cardiology ward. Let's change, and then we can give the room number and the amount will be added. So yeah, so the inpatient has been added. Now what we'll do is that we'll get into the inpatient history. We'll collect the visiting doctor or the nurse will collect the history, and then choosing the doctors as well. And the status will be in observation, and the symptoms. We'll just add the symptoms here. And once the symptom is added, we'll be able to get into the next part where the doctor will finalize the diagnosis. So we'll just click onto the blueprint process, and you can click onto the final diagnosis. He'll mention it is a stroke. And then here, the doctor will be able to map the treatment plan. So he can choose a treatment course or the surgery. So once he click onto the surgery, they will be able to add the surgery related information. So they can choose the healthcare number, and then the date of surgery, when they can schedule the surgery, and the specialist. So for the cardiology, we want a surgeon. So based on the availability and based on the specialty, we have the surgeons who is available there. So we'll choose a doctor, and then the required equipments. So here we will be requiring few of the equipments for performing the surgery. So that details will be added over here. And now upon adding the information, the payment can be done for the surgery on the side by side. So here, once the surgery is completed, once they make the payment and once they have done the surgery, the treatment course will be continued. So here what will happen, once they receive the payment for the surgery, they will perform the surgery, and next comes the part where they will be getting into the treatment course, and they will discharge the patient once they have recovered. So once it is ready for discharge, they can create the hospital billing. So this would be another process similar to the previous one which we saw, from the part of discharge to getting the billing and getting the payment done and further ahead. So now apart from this, we were also discussing about the surgery, the inventories that is available. So you can see we have the all medicine inventories. So this is where we have the medicine inventories for the multiple medicines that we saw and that were assigned to the particular patient. So we also have the available quantity of them. So upon the providing the medicines to the patient, the available quantity will also be reduced. And similar to that, we also have the equipment information. So based on the requirement, these equipment details will also be reduced, and based on the stock reduced, the hospital can raise a procurement and they can purchase the required modules. And here we have the final billing of the number of final billings that has been entered inside the hospital. And apart from that, we also have other reports that can be accessed by the users. So now talking about this dashboard. So this is for mainly for the admin who is part of this organization. So what they can do is that they can make use of this dashboard and they will have an overview on the overall activity that is happening inside the hospital, like starting with the in-house inpatient count and the outpatient count for this week, and they can quickly just get a new appointment booked for a patient, and they cannot just always get into these modules and access the required module, right? So using these buttons, they can be easily redirected to the multiple reports and forms that we have created. So this is all about the modules, and then we have other few charts. So this is related to the inventory of the medicine, and this is related to the availability of the staffs who are inside the hospital. So, and we also have a search button on the top. So if the admin would like to get registration detail about a patient, what he can do is that he can type in the name of the patient, and the information related to the registration will be available over here. So this would reduce the tracking of the patient of within these multiple modules, and this would reduce the tiresome work of searching multiple values in a single report itself. So yeah, this is all about the application, and we were also discussing about how you can share the application to the stakeholder, the patient, right? So what I have done is that we have shared this particular application to a patient, and I have connected my mobile over here. So using the customer portal, the patient will be entering into the portal, and they will be able to sign up into the portal, and they can have access to these modules. So as you can see, we only have a limited module provided to the patient. So based on their roles and responsibility, they'll be able to provide it with the portal based permission, and they can access the required modules. So here we have an appointment booking. So what the patient will do is that, making use of the portal, they can enter into the appointment booking. They can click onto the form, and they'll be able to add in their required information. So let us give the required information, and they can register themselves for the next appointment that they would like to perform. So you have all the requirement details, and then we have the option to view other details. Like, let's get back. So we also have the details related to the online consultation. So if they have made any online consultation, it will be visible. And all the lab results will also be available. So they can just get into the lab results and view the results that has been provided by the technician. And also the other final billing related information will also be available to them. So this is a separate portal that was created for the customer. So yeah, that is pretty much about the application, how we were able to share it with the external users as well. So now, adding on to this, we will also like to explore other extended use case that you can bring inside the creator platform. So for this use, for this particular industry, you can also think about creating an hospital management as an internal tool, wherein you can separately create a application to manage the overall inventory inside the hospital. Like starting from tracking the inventory, the procurement management can be done, and even the expiry and the batch tracking of the multiple medicines that is being procured inside the hospital. And whenever there's a low stock, an alert can be given to the inventory manager or anyone who is tracking the inventory. And you can also create multiple analytics and reports for the data that you have. And now, talking about as a portal based application, so you can create a portal based application similar to the one that we showcased. So here what we showed you was a simple form and few of the modules, but you can also build an enhanced portal where they can maintain their profile, where they can view other health information, and they can book their appointments, and even they can get the reminders, and you can schedule the notifications so that they'll be able to view them. And also you can just create a module to get their lab results as well. And next category is that we can think about creating an application as an extended Zoho or third party application, wherein you can integrate with Zoho Click. So as in inside the healthcare industry, we will be discussing with or working with multiple health disciplinaries, right? So in that scenario, you will have to have a lot of internal collaborations and communication. Through Click, it will be very much possible. And then you can also make use of Zoho Meeting, as in we showed inside this particular application as well, for the online consultation. And even you can connect with Zoho Work Drive to store health related documents. So if you have any other PDF files and any other past history that needs to be stored, that can also be stored in a file inside your work drive. And next we have the Zoho inventory to track all the inventory related information, and Zoho bookings can be used to monitor all the doctor calendar, so their availability, their schedules can be monitored here. So these are few of the extended use cases that you can think about. Now, coming into the end of the session, I'd like to give you a small summary of what we saw in this 1 hour webinar. So we talked about the outpatient management, starting with the appointment booking, and how the in-person consultation and online consultation has been separated, and the lab testing process and other follow process that can be followed inside an outpatient management. And not only that, for an inpatient, we also saw the process of having a new admission, how the treatment plan has been done, and how the treatment course has been administered and monitored, and how you can assign multiple stakeholders for the responsibility. And next, we saw about the inventory in brief, and where we talked about the medicine and the medical equipment stocks which has been handled. And talking about the few features that we have incorporated in this particular solution, we started with the report workflows where we had a lot of custom action buttons. And along with that, we also showcased you the portal, how the customer portal is being assigned to the individual patients and how they can enter into that to view multiple modules. And we also looked into the record templates where we created a separate record template for the lab results and also to get the billing related information as well. And at the end, we also had multiple blueprints to have a track of our business process, the multiple treatment process that we had, the lab processes that we created. So those were tracked using the blueprints. So this is what we wanted to showcase you for this particular solution. And yeah, so apart from this particular webinar, we would also like to share you few more information regarding this. So we have a free webinar which has been organized for the Zoho RPA, which is nothing but the robotic process automation. So this is another tool of Zoho which would allow you to perform business automation inside your solutions. We are organizing a 3-day webinar series, which is a get to know series. So this is organized between the September 10th to 13th, and it is happening between 3 different regions and 3 different time zones. So if you are interested in knowing more about the robotic process automation in Zoho, you can sign up for this particular free webinar and you can get to know more about this tool. So you can make use of this QR code, or even you can make use of the link that would be shared by my co-trainer in the chat section. So I'll keep this open for another minute and then we'll move on to the next part. So apart from the free webinar that I just mentioned, we also have online trainings which is happening. So for this month of September, which is a developer month, we are providing a 50% discount on the training cost. So we are organizing 2 different trainings that is usually done. So for this month, we are providing a 50% discount. So if you're interested in joining the training and getting yourself understand about the other different concepts in Creator, you can join the training. And post the training, the participants will be given an opportunity to take a certification examination as well. So yeah, this is all about the training. If you're interested in joining the training session, you can scan the QR and look into the schedule that is available inside our website, and you can register yourself. Or even you can make use of the link in the chat section and you can register yourself as well. And now other free webinars. So apart from the training and the RPA webinar, we also have the monthly webinars that we usually conduct. So the first one is the Creator Tech Connect. So in Creator Tech Connect, we take an advanced concept in Creator and we touch the advanced nuances in the particular feature. So for this month of September, we have a Zoho directory and we'll discuss in detail about the Zoho directory. And it is happening on 12th of September at 4 p.m. IST. And along with that, we also have the Learning Table series. And this is also a month-on-month webinar where we take a particular industry and we try to build a solution. And for this upcoming month of October, we have the non-profit organization. So this is also happening on October 3rd, which is for 4 p.m. IST. So if you're interested in joining this session, you can scan this QR, or you can also make use of the link that is being shared in the chat section by my co-trainer as well. Thank you so much for actively participating throughout the session. I'll be keeping the session open for another few more minutes, and then answering all your questions, we can close the session.